In case you didn't know, you're breathing right now, which means you have lungs, one or two lobes. It may not be very efficient, and your lungs may hate them at times, but you still have them. Alright, so I'm going to demonstrate what lungs are, in case you didn't know, and how they work, and some more details on that as well. So, this is a model, not real, obviously. This is our lungs, or this is our trachea or our throat, this is your mouth and nose. Down here, this is where our lungs begin inside. So right here, this is the blue balloon is our lung lobe. We have two of them, one on either side. All right, and so think of our lungs on the inside, what you can't see, as an upside down tree. We have that big stalk that you can see climb right here. And then you go down and it branches off like branches, and then like thin little pieces, like the leaves, are called alveoli. So that's where our gases are moved around our body. Oxygen in, carbon dioxide out. That's how it works. Alright, so in case you don't know how lungs work, how we get the oxygen in and carbon dioxide out, I'm going to make the demonstration for you. Alright, so everyone has a muscle called the diaphragm between the liver, small intestines, and their heart and lungs, right around their rib cage area. So as that muscle right here in your body moves down, it causes a vacuum to be had in your lung area. So like this, as the muscle pulls down, it opens up the lungs and causes a bunch of air to rush in. And then, like a moment later, without us even thinking about it, that diaphragm goes back up and it kind of pushes that air out. The lungs are just that blue balloon, for example. They don't do anything, they're just there. There's no muscle attached to it specifically. There's muscles around it, like on your ribs, but the lungs just don't do anything. Alright, so now things that can affect how we breathe, how efficiently, or other issues. Things like asthma, things like pneumonia, things like tuberculosis, things like smoking, vaping. Those have negative effects. Pneumonia causes like a mucus membrane, or mucus, to be filled on the bottom. And that causes the lungs to not be able to move the air or gases around efficiently. Smoking and vaping, they throw in tiny, tiny little little pieces of tar and other chemicals that our body doesn't need or like everywhere in our lungs and body. And over time, that can destroy the lungs and decrease the efficiency of it. Asthma, what asthma does is when a person has an asthma attack, is their lungs, their branches right there, go from nice, round, smooth, air can go in, like that, nice and easy. But during an asthma attack, it constricts. So it's harder for the person to get the air in and the air out. And that Russian air going through that small space is what causes the iconic wheeze. I'm not going to even try it. During that time, a person will need to have a rescue inhaler with them at all times, just to help them open up their lungs. If they don't, they can very well die, because our brain and the rest of our body will not be getting the oxygen that is needed to survive. That's why it's so important. Things that can trigger an asthma attack depends on the person. It could be stress, it could be lack of sleep, it could be dust in the air, pollen, allergies, a number of different things. But that person will need a rescue inhaler, or in worst cases scenario, an EpiPen. Hopefully don't need those because those are expensive. Alright, with those rescue inhalers. So albuterol is a very common medication for asthma because it comes in different forms. It can come in pills. It can come in inhaler. It can come in like an inhaler where you put the mask on your face and it just makes a gas of a liquid, so you breathe it in slowly. If it's inhaled, what the person will need to know is to rinse or wash their mouth out after they're done, because albuterol does contain a steroid and can cause thrush if it's not taken care of, or their mouth is not, they don't do proper oral care like brushing their teeth. Kind of gross. For the average person, or especially for those who have breathing issues or deficiencies, they will need to talk with their healthcare provider about what they can do to decrease the effects or risk of an asthma attack or breathing issues. A nurse, when it comes to nursing care, a nurse will know to tell them to not be so physically active, especially when there's pollen outside, there's a dust storm like Arizona has, or to decrease their stress and to know what those triggers are for them so that they can manage around it. Also, like I said before, make sure that they have a rescue inhaler. It's a rescue emergency, not an, oh, I'm going in for lunch, let me get this. No, no. If you're fine breathing, you don't need it. If you know that you're going to have difficulty or an issue with breathing shortly, go for it. But make sure you talk with your doctor and or the nurse before you do anything. That way you get the proper information, proper treatment.